Hey, I'm Dr. V with Origin. I want to share a little bit more about NUCCA and how it's impacting our patients, how it's impacting the body. There's so many cool things that go on, and let's take a deeper dive in how your brain is connected to the rest of your body. So I wanted to jump on here real quick and break down a consultation call I just had with a patient earlier this morning. And it's a really good time because everybody is talking about vagus nerve and vagal tone. And the lady I just got off the phone with was using a Pulsetto device. We actually have a Pulsetto device here, and she's using this device as the only way to manage her POTS. And POTS is postural orthostatic tachycardia syndrome, for those of you who don't know. And it's something that really just impacts the nervous system, in particular, the patient's ability to lay down, whether the nausea starts to come on for certain patients. The nervous system is on edge, essentially, or it's really sensitive, and that's just the bulk of the main symptoms, but there's a lot of other things that go on. But really, what I want to focus on is this vagus nerve, this thing that everyone keeps talking about. The vagus nerve is actually the longest nerve in the body. It's a cranial nerve that comes from the medulla oblongata and goes all the way down to the abdomen. And there's different branches of the vagus nerve. And so that means there's a lot of areas that are impacted when the vagus nerve isn't functioning as it's supposed to. Now, one of the unique things about this really long nerve that's coming from the brainstem is right where it comes out from the base of the skull, next to C1 and C2. C1 and C2 are the top two bones in the spine. On the anterior portion, to the front side as it exits, if there's any misalignments of C1 or C2, it's going to create mechanical irritation or distortion. And so this isn't a bone on nerve. I don't want people to sit there thinking that I'm referencing a bone on nerve. That's not happening. There's also other tissues and other structures around it. But when you move the bone in a particular direction and it's fixated or misaligned in that position, it's going to reduce the impact that nerve has on all the other structures and organs. And so the reason why we have a Pulsetto device is a patient brought it in and said, hey, this is what I'm using. So clearly not our first case of someone using a vagus nerve stimulator. And we want to know, okay, if we're getting a lot of patients with migraines, headaches, vertigo, hormonal imbalances, just nervous system regulation issues, what can we do to help them? Because we know NUCCA in our office is very beneficial to those patients. And we know this because we take objective measures before and after, and not only are we seeing the structural shifts, we're able to track that in the patient's subjective findings, so what they're feeling, the symptoms. Now, when we use NUCCA to understand what vagal tone looks like, or what the impacts of vagal tone reduction looks like, is we're focusing on the root cause, that mechanical tension or compression of the vagus nerve, whereas those devices are looking at symptom management. So it's maybe sending electrical pulses or it's sending some sort of tapping, but it's not fixing that bottlenecking structural issue. Now, the vagus nerve also has two sides of it. It's got an afferent and efferent side, and 80% of the vagus nerve is actually afferent. The reason why 80% of it's afferent is that means coming up towards the brain, and efferent, the 20%, is coming out of the brain. And so you need to have good signals coming in, and then you need to have good signals coming out. The vagus nerve is more than just something you want to stimulate. You want to actually understand where is the breakdown in that communication so that you can correct that. And so we use a personalized 3D vector, and that's just a fancy way of saying we're going to take imaging of your head and neck. We're going to look at all the bones in the structure. We're going to figure out what's your neurological and your structural neutral, come up with your specific numbers where you're designed to be, and then get you to that point pretty much immediately on that first treatment session so that then your brain can understand this is what a good position looks like. And so now you're changing the joints, you're changing the ligaments, the muscles, the neurological communication. And unfortunately, even though these devices are very good, they get good at giving this sort of short-term benefit, you're not getting this long-term sustained relief, but you're also not getting this personalized approach to your health. These devices tend to be a one-size-fits-all. And that's one thing I want to stress at is if you're feeling that you're potentially like plateauing in the breath work that you may be doing or any of these vagus stimulation devices, your body's showing you that you may need something a little bit more specific, um, more tailored to you, and not just this blanket shotgun approach. And so back to this patient that came in, sorry, we did a virtual consultation, my bad. This patient that we just spoke to, that did their discovery call, it's unfortunate, but there's a lot of like going down the list and checking things off of this didn't work, this didn't work. It isn't that one thing worked and another thing didn't. I often stress to patients that what are you doing in what sequence are you doing it in? If your brain isn't connected to your gut properly, and that vagus nerve is one of those things that is connected to the gut, that gut brain axis is going to be off. That HPA axis is going to be off. So you might be eating and changing your diet and doing all those different things, and you're like, I'm getting benefit, but I'm not seeing the results that so and so got over here. They may have less disruption in the gut brain axis than you do. And so this is where we say, okay, what's that balance look like in the body? And what order are you doing things in? Making sure that the brain is connected to the gut, making sure the brain is connected to the muscles so that the rehab is better. The supplements that you're spending a lot of money on nowadays, which I was shocked at how much she was spending on her diet. Not from a, you shouldn't spend money on your diet. Yes, eat good quality food, making sure you're supplementing correctly, but don't overdo it. You may not need as much. If your gut brain axis is working, then you might not need to take the same dosage as recommended for another case or another person. And so being specific in what you're doing, but being efficient. Because if you're pooping out all of the supplements and nutrition you're eating because your gut's only at 60% efficiency, not because the gut is the problem, because the connection from here down is the issue, then let's fix that and then look at how much do you really need to eat in this particular category of nutrition to help repair certain things. And so it's not taking something out of another doctor's office, or it's not a pill or a potion that isn't working. It's what order are we doing things in? And when we enhance that full brain to body connection, not just the parasympathetic nervous system, which is what the vagus nerve sits in, we're getting that improvement structurally, that sensoromotor connection, that feedback that a device isn't doing. It's just stimulating one aspect, one half, or one third, or 80%. It doesn't matter. It's still not getting everything, it's getting a piece. And that's where the clinical applications of NUCCA is awesome. When you look at what the vagus nerve does control, like sleep, gut motility, immune function through the spleen and the liver, HRV, which is something that's really important nowadays that people are tracking through Aura rings, different kind of devices. You're looking at what your heart rate variability score is, and you want it to be adaptable. You want your heart rate to not be the same methodical, just beat, as much as we're taught to think that. There should be a little bit of variation. That's adaptability. NUCCA is using that innate ability that the body has to heal itself, to understand the neurological connections, to improve. And we've seen that improve those HRV scores. When your HRV scores improve, that means your sleep is better. That means your workouts are going to be better. Your body is adapting to what you're putting it in. And it's not just having the same sort of constant drone. And that's the other side of it when you look at certain devices, not the Pulsetto device, but there's other things where you can just sort of hold to your neck and it's giving you the same sort of stimulation. That's actually the opposite of what you need. Is you need to have some variance. And so NUCCA's approach is looking at how do we map the body? How do we take the body to that position and help that person sustain that long term? And even though I didn't explain the entirety of this to that patient on our call, we wanted to provide as much clarity as possible and not discourage her from all the stuff that she was doing. Just finding a little bit more process or method to the madness of what needs to happen, and that sometimes less is more. We like to throw this out a lot in healthcare, but if you're taking 30 supplements twice a day, you're working out, and you're feeling like you're constantly in resistance or you're hitting a wall, it's because your body isn't in alignment. You're not in alignment with what it needs or what you want to do, because would you rather be out there playing with your kids, having fun, doing things with your family or your loved ones, your friends, or at doctor's appointments or at the gym because you really need to hit a particular number because that's the only number you can hit in order to get results? So where are the inefficiencies and how do we create efficiencies in that? And so that's really where a lot of the conversation was with this patient, is trying to create a process that was unique for her on how do we build this up where your healthcare routine is as streamlined as possible, but serving her for what she wants and her goals. And one single device can't do that. Doing a breath meditation through an app is great, but it's not the interaction that sometimes we need to. And so without going down the rabbit hole, health is complex, but it's as simple as we want to make it. And it's not conforming to this one thing and this one structure and saying, okay, how do we be dynamic? With POTS patients, they may actually be suffering from a lot of specific cardiac issues. It's in the name. And so when a patient has syncope, heart palpitations, any imbalances in HRV, that heart rate variability, that is a mechanical feedback loop that's broken at a structural level. And when a person has a reduced parasympathetic tone, and it could be from concussion, it could be from whiplash, it could be a sudden onset of POTS. Typically, it's usually a series of events that builds up. The patient will notice with NUCCA that after a certain period of time, the syncope rates of incidence drastically reduces. The heart rate variability score drastically improves. Their parasympathetic tone is back to where their body can regulate itself. When someone has a high level of anxiety, the vagal afference is essentially high. And with NUCCA, we can drop the vagal afference, which actually helps the amygdala and the cortex, which is inside the brain, which is where we're able to reduce that tension, not just in the vagus nerve, but anxiety. When you're constantly fighting to stay upright, when you're constantly in the structural position that is inhibiting or creating resistance, your body isn't able to handle external stimuli to the same extent. So when you reduce all the noise going on inside, you can increase your capacity to handle the stuff going on around you, which is what anxiety is. It's that inability to process external stimulation in most cases. And so we're not just looking at it from a chemical imbalance. This could be a structural mechanical imbalance, which is why we constantly drill and go through a really thorough screening process. We don't want to take patients we can't help. Why we have the virtual consultation call, so that with this patient and many others, we might realize that this isn't the solution for them. They're not a candidate for care, and they may need just a vagus stimulating device. They may need acupuncture. They may need a different type of physical therapy or personal training where their body just needs that kickstart into getting momentum in the system in the right direction. And so NUCCA is definitely one of those things that can help. But we want to be specific: is this a mechanical issue? Is this a structural issue? Is the blood flow and the CSF flow impacted because of this misalignment, which is creating imbalances in other areas that will still relate back to POTS or migraines, vertigo, so on and so forth. Stimulating the vagus nerve is like pressing the gas pedal in a car, and the wheels are misaligned. You're forcing the car to go in a direction, line one wheel pointing this way, one wheel pointing that way. You're forcing a system that isn't balanced. So if your vagus nerve is like the main fiber optic cable running between your brain and your body, you're trying to create stimulation in an area where no matter how much you give it stimulation, it's pinched off, it's bottlenecked, and you're not going to have that full signal and clarity of the information that's passed between the brain and the body.